So as we talk about the patellofemoral joint, the anatomy is really going to be thematic, where it's basically a small joint taking on large loads. So we have a sesamoid bone in the quadriceps mechanism that has a ridge down the middle and a medial kind of patella facet. There's something called an odd facet on the far medial side. And then you have these lateral facet, and some people break this into kind of other kind of horizontal facets, but they're really not that obvious. The medial and lateral facets are the most obvious. Then on the femur, we can see there's some important characteristics here. We see that the lateral side of this intercondylar groove on the femur is much higher than the medial side. So we have this kind of anterior medial condyle and this anterior lateral condyle by this terminology, but this anterior lateral condyle is much broader, and so what it's going to do is this kind of wedge-shaped bottom surface of the patella is going to fit in this groove, and this lateral condyle is going to block the patella from moving laterally. So this anatomy is important. But to overview, the role of the patella isn't insignificant. So one of the first bullets here in terms of patella function is it increases the mechanical advantage of the quadricep muscle. So if we look at this anatomically correct diagram with the forces here, we can start to imagine the moment arm of the patella tendon with the patella bone in the middle of the muscle here. And if we remove that, which is a treatment that's for irretractable pain due to patellofemoral syndrome, you can have the patella removed. If it's removed, what happens is your moment arms reduce significantly, resulting in a 30% reduction in the ability of the quadriceps muscle to generate torques, to deal with torques around the knee joint. So basically, it's important to note that sesamoid bones increase the moment arm of the muscles that they're in. And in this case, the quadricep mechanism, about 30% of its effectiveness at the joint level in terms of its mechanical advantage is influenced by the patella. It also protects the articular cartilage in the front of the femurs. There's very high loads, which we'll meet in a minute, and transmits tensile forces to the quadricep muscle. So here's a diagram of the type of forces we're going to be talking about today, where we look at this kind of double force pull on the patella. So as we contract our quadricep muscle, we're pulling it posteriorly, but then the attachment distally kind of pulls the inferior pull of the patella as well. So we get this kind of resultant muscle force compressing the kneecap into the femoral groove. And so what we can notice is that the patellofemoral joint reaction force is quite high during common activities. So level walking, it's been estimated at 840 newtons, rising from a chair 3,800 newtons, jogging 5,000 newtons, and then descending stairs equivalent to a chair, right? So we're talking about loads that are quite significant and several times higher than body weight. So it shouldn't be surprising to us that the patellofemoral joint undergoes experiences significant problems and has a significant adaptation to these loads, like very thick articular cartilage on the undersurface of the patella bone.